So for more on the new mask guidelines, I want to bring in Dr. Jennifer Kwan. She's a family physician and joins us from Burlington, Ontario. So Dr. Kwan, what's your reaction to this change in tone on masks on multiple fronts today, going from, I'm paraphrasing, but a good idea, I think were the words of Dr. Tam, to recommended?
I'm really glad that the messaging is changing to be more strongly recommending Canadians to use masks, especially in high-risk settings. So this is very important because masks are good for both health and the economy. In order to have a sustained, safe reopening, we do need to use every factor possible to prevent COVID-19 infections, and mask is one of the important things in addition to sustained partial distancing, testing, and tracing.
Should we have been wearing masks all along?
I think there has been a lot of changes in the tone due to emerging evidence. Hindsight is always 20/20, and I think that some countries were earlier than us to adopt masks as a strategy. I'm glad Canada has also implemented that now.
One of the criticisms of mask wearing for the general public is that it might give people a false sense of security, and then they might not respect other guidelines, or people don't have good mask hygiene. What's your take on that?
I think alongside with these new recommendations, it would be great if the government could also put out more public messaging campaigns, showing people how to wear a mask, where to buy them, how to make them, how to clean them, and also kind of more clear messaging on when they should be used. So one acronym that my group Masks for Canada came up with is ACT. So all indoor places, crowds, as in when you can't distance 2 meters away from others, and transit, including public transportation. So I think that's a good, concise summary.
So when you say all indoor places, do you think people in, basically, is that what you mean? Do you mean everywhere? So if you are inside a building,
public,
pardon?
not like in your own home.
Not in your own home.
So like, like a grocery store, businesses, malls if they open, shops, like anywhere where you're in a confined space and there's not really enough ventilation. I'm sure there are some small details, but I think these are the general guidelines that would be helpful.
So what about offices? If people are going back to work and going back into their office, would you say it depends on how big the office space is, or what would you say?
I think that in the office, if there is inability to distance 2 meters away from others, then definitely. But even if you can distance 2 meters, it also depends on like ventilation and how many people are in a confined area. So I think that any business owner who cares about the health and safety of their employees would definitely use masks as one of the strategies to prevent an outbreak.
It's interesting, we listened to Dr. Davila, who is the Chief Medical Officer for Toronto, and she said, she recommends it in a grocery store, in an elevator, similar to what you're saying, but not if you're walking on the street and there's plenty of space, or if you're out for a run or a jog, but try and plan ahead because you could end up in a situation where there isn't space. So this might be hard to navigate because you could just sort of suddenly be in a situation that you didn't expect to be in. So would you recommend that people walk around with a mask in their pocket, or what do you think?
I think it's better to be safe than sorry. So if you have a mask in your pocket, then you could use it in a situation. Maybe you ran into your neighbor on the path and you want to have a quick chat. So putting on a mask might be protective for both of you.
But just to remind us, it is to protect you from others, not the other way around. You want to just tell us a little bit about that?
So the messaging around masks has been that my mask protects you and yours protects me. And the way it works is that it catches droplets from your own mouth and prevents transmission. On some level, depending on the fabric and the proper usage of the mask, it probably does protect the wearer. But people are hesitant to say that for sure, just because that really depends on what type of mask we're talking about.
And forgive me if I'm asking you a question that's outside of what you know about this, but in some places it's mandatory. Here it's recommended. In places where it's mandatory, have we seen any evidence that everyone wearing a mask works and helps stop the spread? Do you think it should be mandatory?
There are definitely some countries, not just Asian countries, actually even European countries, including Germany, Spain, Austria, Czech Republic, and some others that have mandatory mask laws. And making something mandatory doesn't increase compliance. And the more people are wearing masks, the more effective we are at controlling the infection. Right now, it is strongly recommended. I do hope that Canadians will listen to that messaging and take it into consideration. If there isn't enough compliance and then we see that there are further outbreaks, it's not being controlled, I would not be surprised if the officials decided to have more stricter measures.
It was interesting, Dr. Kwan, we listened to John Tory, and he tried to dispel. He said, some men don't want to wear masks because they see it as a sign of weakness. He used that example. Do you have concerns that there is going to be people out there listening that are just going to resist this idea of wearing a mask in public for whatever reason?
There's definitely reasons people don't want to or cannot wear a mask. So there are exceptions for people with medical concerns, young children, people with disabilities. So there's definitely exceptions. That's why if many people wear a mask, then we also offer some protection to those who may be more vulnerable. I think masks will become the cool Canadian thing to do. Like, it's a polite thing. You're protecting others. You're showing that you care about other people's health.
Dr. Kwan, always good to speak to you. Thank you very much.
Thank you.
That was Dr. Jennifer Kwan, a family physician, speaking to us from Burlington, Ontario.